Hi, I'm Dr. Stephen Olmos, and I want to welcome you to this week's edition of Ask Dr. Olmos. Today's question is, can you help me with headaches? Well, it depends on what kind of a headache you have. Headaches that are caused by trauma, bleeding, or tumors, anything where there's an organic reason for the headache, well, that's certainly a neurologist, neurosurgeon likely necessary for those kinds of headaches. The more common headaches, the migraine, the tension type headache, even cluster headache, are called primary headaches. And what that means is that those are more vascular in nature, where it isn't a direct trauma to the brain and the feeling around it. You have a protective pad around your brain called it's called the pad, pia, arachnoid, and dura mater. And so in the middle portion, the the pia layer, is where your blood vessels reside, and that's where the nerve endings are. Your brain itself doesn't have nerve endings, so it has to have something that's affecting that cover layer around your brain, the pia layer, for it to for you to be aware. And so that's why a tumor or bleeding or something would cause this issue, or strain or trauma from a head injury. However, the other type of headaches are called primary. And primary means that when you take an X-ray or an MRI, there's no structural damage. There's a normal, healthy, functioning brain. The problem becomes more vascular. So that means that the blood vessels are inflamed. So that's what a migraine is the blood vessels around your brain are swelling because of systemic inflammation. So that's inflammation coming from your whole body. And then there's markers because you're so sensitive that it only takes a little bit of one thing or another, a little stress, maybe a little dehydration, maybe you miss a meal, and bingo, your head's killing you. I used to be that person, and through treating the reasons why that was happening, I'm completely migraine free today. But I lost a lot of days at work because of that, and it's terrible. I'll try to explain that to another person how awful a migraine headache is. And analgesics don't really make that better. There's migraine abortive meds, but they're exhausting to take for anybody who's ever had a migraine. The feeling afterwards. There's tension type headaches where people have pain either in the temporal muscle or the masseter muscles after they wake up or upon awakening. This is from clenching during the night, and very often clenching is because of pain in some other place. Maybe they have a breathing disorder, either nasal obstruction or throat closing, like obstructive sleep apnea. So once you find the origin of what that problem is, then you can address it. And then there's another type called cluster headache. These are terrible headaches. They're termed to be the worst headaches on the planet. And those come in clusters. And men usually get those kind of headaches and forcefully banging their head against the walls trying to get relief. Recent literature has shown that to be related to a breathing disorder, obstructive sleep apnea during REM sleep. REM sleep is where you're catatonic, all the muscles in your body relax, so it worsens your breathing problems, your throat closes more, and you become hypoxic. Less oxygen causes tissue to start to die. And because what we've always known about cluster headaches is that if you give people oxygen who are having those headaches, you can abort the headache over 70% of the time with just oxygen. So now we know the mechanism is really hypoxia, and that means you don't have enough oxygen to make the tissue survive. And so treating the breathing problem during sleep prevents the cluster headache during the day and upon awakening as well. So those are certain kind of headaches that then can be assisted in our office. The primary headaches, that's the kind of headaches we have. The kind of headache where someone says, I've had headaches for 20 years. Okay, that's what we deal with. There's other kind of headaches. You can have headaches, let's say you're a person who's never had a headache your whole life. And then now, let's say you're in your 50s and you now have some headaches that you never had. That's pretty dangerous. That's something that you need to see a neurologist for. Because if you've had structural problems that weren't proper, then you're going to have headaches your whole life. But if everything was working fine, and then later in life you're having this headache, well, there's a reason for it. and you really need to get that checked out. Those are all very serious. So the only way we can know is have you come in, look at your history, do examinations, and then we can come to conclusions as to how we can help you. And but we've been very successful with many patients over the years with these primary headaches, and I'm one of them. Thank you.